As someone that deals with low back pain patients on a daily basis, I commonly get asked, what are the best exercises for low back pain? So the thing is, that can be hard to answer because low back pain is so multifactorial that one exercise that might be good for someone might be bad for someone else. But in general, the 3 exercises that I recommend that are good for most people are the side bridge, the bridge, and the bird dog. So with these, the first step that you need to make sure you're doing with all of these is contracting the transverse abdominis and the lumbar multifidus, which are the muscles that surround the spine and the muscles that are in the abdomen here. So what we want when we're doing that, what we're gonna feel, it's gonna be similar to bearing down, like when you're sneezing or using the restroom. When you contract those, you're gonna feel a tightness in that area. It helps to put your hands on that area to feel it contract. Bearing down and just learning to get that contraction is really the first step to all of these exercises. Once you've done that, we then go on to the exercises. The first one, like I mentioned, side bridge, also called side plank. It's similar to a plank. Generally, I recommend for people to go with their knees bent, their elbow at a 90-degree angle. You're gonna start in this position. You're then gonna contract that abdomen and come on up. And you're gonna hold that. Generally, I recommend that people hold that for around 30 seconds to a minute. Generally, people start off closer to 30 seconds, doing 3 sets of that. Then we go on to the bridge. So with the bridge, again, contracting that abdomen. Once you've got that contracted, hands at your side, coming up into a bridge. Great exercise, really strengthens the transverse abdominis and the lumbar multifidus, helps to really support and stabilize that spine. And then again, with that, 3 sets, trying to hold it for a minute, start around 30 seconds usually. Then finally, we have the bird dog. Bird dog, you start off in quadruped position, which are hands and knees. Again, contracting that abdomen, contracting those muscles of the back. And with this one, you can kind of do a few things. Generally, I recommend people start off going with one hand while keeping that contraction, keeping the balance. Then you can progress to one leg. Again, trying to keep that contraction, keep the balance. And then finally, one arm and one leg. Generally with that, it's more of a 3 sets of 10 repetitions, something like that. Hold the contraction of the abdomen the whole time. You can get even more advanced. I've seen people do same arm and same leg while the other side is moving. I'm not that good, but if you get to be that good, you're gonna have a really stabilized abdomen, you're gonna have a great core, and you're going to really reduce your chance of having low back pain.